Hi, welcome back to Coco's house.
G'day guys, she's sharing her couch with us. What are we up to? An update?
I'm back from hospital. Chris picked me up yesterday morning, and then we went and had a nice lunch, did a little bit of shopping.
Walked around the shopping plaza for more than Christine's walked for about 2 weeks.
But I survived it.
Yeah.
And after that we had our appointment with our breast surgeon.
That's right, yep.
So we have a new date for my breast surgery, which I'm having an oncoplastic lumpectomy, and Chris can take it away from here because he understands a lot more than I do. I blame everything on chemo brain.
Well, I didn't actually read what the oncoplastic bit was.
Okay. I think the difference between, from what I understand, a lumpectomy and oncoplastic lumpectomy is that with a lumpectomy, they just take out whatever they take out, stitch you up, and then you're done. With an oncoplastic lumpectomy, they're going to take some, I was hoping for belly fat because I got enough of that, but they're going to take some fat out from near my armpit, which will be on this side, and then they'll replace what they take out of my breast with the fat that's on the other side.
So there won't be a divot as such?
Exactly, yeah.
Right,
so it's kind of like a plastic surgery at the same time that she's doing the breast surgery, but it's not a major plastic surgery. And she's also going to be taking out 2 sentinel lymph nodes, is that correct?
Yep.
To check those. There's been no cancer detected in my lymph nodes so far, but I think it's a normal procedure to check.
Well, the idea, they put a dye in, don't they?
They're doing a wire tracer as well as a dye.
Yeah, but I think they put a dye in near the cancer site, and then they see which lymph nodes actually pick up the dye. They're what they call the sentinel lymph nodes. So they then know if the cancer was to travel, that's the lymph nodes it would have gone to.
Oh, so they remove that?
So, yeah, that's why they call them a sentinel, because they're kind of the lookout nodes for that area.
Oh.
So that's how I understand it.
That's why I have him.
So they'll take them out just to check, but she doesn't expect there's going to be any. She's going to take out a bit extra margin around what's left of the tumour, which is likely just scar tissue.
We're hoping. But
So,
given that nothing else has gone right so far, it's
well, hang on.
something's got to go right?
Most things have gone right. You're still here.
Well, yeah.
And yes, you've had some side effects, and this last thing was unusual, but everything else has really actually gone pretty well. It's not supposed to be a holiday.
Forever the optimist.
Speaking of holidays, she had 4 days in hospital, 3 nights, private room.
Sunday night, Monday night. I had 4 nights in hospital.
4 nights, okay.
A private
Comfortable,
room.
good, fantastic staff.
Yeah, they are.
And you were able to taste food. That's like a holiday.
You know what was interesting? When I did the update video from hospital the other night, I read all the comments. So you guys know I don't very often comment on your comments because there's a lot of them, and I just don't know what to say to everybody except thanks very much.
Plus it would take too long.
It would take too long. Another thing I want to say whilst I remember, a lot of people when they comment, they say they don't like doing the thumbs up because thumbs up for cancer is kind of like not a very good thing. I love it. So give me as many thumbs up as you like. Thumbs up on the cancer channel is perfectly fine. Don't feel bad about it. Thumbs up is a good thing. But
you were going to say about someone you met?
Yes.
Yes, I thought so.
A comment that I received and found, I think it was the next day because I put the video up at about 1 o'clock in the morning, and I got a comment the following day, and the lady said, she mentioned the hospital that I was at. Are you at this hospital? If you are, I'm in room 314. And I hope I'm going to get the lady's name pronunciation right because she had to teach me, and I wasn't a very good learner. Mayolay, I think. It's Dutch for marjoram, which is a herb. So anyway, as soon as I saw that comment, which room she was in, because I was in room 23, which is only 7 doors down, I took a walk, and it was like a big walk for me that hadn't been able to walk for a little while. So I went and knocked on the door, and all you can see is my feet. So she probably thought I was one of the nurses. I pulled the curtains back and I said, "Hi." So that was a bit exciting. And anyway, then we had dinner come, so I had to go back to my room. And she also came and visited me late that night, or later that night. We had a really good chat. She follows me on the sewing channel as well as this channel, so it was good to talk about sewing and quilting and that sort of thing. And met her husband yesterday, the following day when she was going home, and Mum was there visiting me. So that was really nice to catch up with a YouTube viewer.
You know you got a big YouTube channel when someone random at a hospital knows you.
And she just recognised the backdrop in the hospital that I was at. So
that was a real buzz.
Funny. It was a buzz,
great.
So
anyway, back to the medical journey.
Back to Coco,
She's home.
Yes.
Now, have you told your viewers what happened?
I had adrenal failure.
Yeah, had you... Oh, you said that when you're in hospital.
Yeah, but for some reason I've been calling it a renal failure. I haven't had renal failure, I've had adrenal failure.
That's right.
Which means that my cortisol levels were completely gone in my body. It was in the negative. And as a result of that, I don't know if it was a result of that, but now I also had to have a magnesium infusion. I had a couple of cortisol injections, and I now have to take cortisone tablets twice a day for the rest of my life. And then
the damage to the adrenal glands is permanent.
Yes.
And we think it's a result of the immunotherapy, is it?
Yes.
Yes.
Yeah, pretty certain it's the immunotherapy.
So unfortunately, these chemo drugs and the immunotherapy are designed to attack cells, and the cancer cells they kill, but unfortunately there's sometimes collateral damage. And that's
what the endocrinologist said as well.
Did he?
About the collateral damage. Yeah.
I must know what I'm talking about. But basically, it's they kill a lot of cells indiscriminately. Most of them are the cancer cells, but sometimes it's other cells. And our breast surgeon said this is pretty unusual, didn't she?
Yeah, she said it was quite rare, I think. Yeah.
But there's been damage, and we've just got to cope with it. But ultimately, if you choose to take a pill for the rest of your life, it's better than
not having a life.
Yeah, absolutely.
True.
And really, most people over 60 are taking pills every day.
Except for you.
Well, I said most. Maybe I should.
Yeah, just for the sake of it.
Send me some pills.
The other thing I have to do now is take another tablet to increase my blood pressure, because my blood pressure is quite low. Every time when I was laying down, it was lowish, and then when I would stand up, it would drop even lower, and my heart rate would go right up when I would stand up quite dramatically. And so now I have to take something for that. It's something that starts with F. And then I also am still on the beta blockers, but they had to cancel that over my few days in the hospital because it was affecting other things. But the cardiologist has refused to stop me on it. He wants me on a quarter of a tablet morning and night. Yeah. I'm actually finding, I feel myself that that's not quite enough because I'm feeling the palpitations again. So I'm monitoring that. I've got my heart bug back on that was taken off for a few days whilst in hospital. And I'm keeping a note of the palpitations, and I'm just going to contact my oncologist on Friday and have a talk to her about that. And I also have to have blood tests done tomorrow as well.
Yeah. So it's probably going to take a while for all these medications to settle down, and hopefully we can get a good balance where your blood pressure's stable, you don't have the dizzy weak spells, and yet your cortisone's still going okay.
But today I potted around, I did stuff in the kitchen, my son came to visit, and I took it easy on purpose. I did walk into my sewing room. It was icy down there, and I kind of just relaxed in the lounge today. And tomorrow I'm going to go and sew something all day.
So
I think
the improvement has been been pretty good.
Yeah,
It's
yeah.
I won't say remarkable because you're still a little fatigued, and certainly if you do a bit much, you notice it. But it's miles ahead of where you were last week,
Yeah.
obviously.
And I just have to learn to take it easy a little bit more, I
Yep.
think, until we can get the medication right.
And also, your body is still getting over the chemo drugs, even though they're out of your system in around about a week. Apparently, it still takes quite a while for everything to pick back up and recover.
I actually managed to get some taste buds back on the weekend, so I ate like I have never eaten in my life before. All the food they bought me at the hospital, which was quite a lot, I ate nearly everything, whereas the past couple of weeks I've barely eaten a thing. I couldn't eat much at all. Everything tasted awful. We have a new surgery date. Originally, when I was told last week, I'd got an email and it was going to be, I think, the 23rd of July.
That's right.
It is now on Friday, the 18th of July, and today is the 2nd of July, isn't it?
That's correct.
Yep.
Yes.
So Wednesday, the 2nd of
so
July.
a bit over 2 weeks.
Yep. So 18th of July, we're having the surgery. We have to go early in the morning to have an ultrasound procedure, to have one's for the dye and the other one is for the a wire hook thing.
Yeah.
So one's done via ultrasound and the other one is done some other way. And then the surgery will be in the afternoon.
I think the wire is a locating device. Yeah,
it is.
Even though you have a seed in there anyway.
I do, yeah. Now, there's going to be complications with the surgery because of everything that happened over the weekend and the lack of cortisol in my body. A procedure that should only take a couple of hours and a few hours in recovery after surgery, and then going home that day or the day after. I'll now be in intensive care for at least 24 hours, and if I recover well from that, I'll go into the ward for perhaps another day, and if I recover well from that, then I get to go home.
And the intensive care is really just so that you're monitored closely.
Because of my cortisol levels.
Yeah, they couldn't just put you in a room and you press a buzzer if something's going wrong. They need to keep an eye on your obs and everything.
Yeah.
But yeah, I think it's good that they're doing that. Obviously, I don't want you out of hospital when you're not fully
functioning.
Over it?
No, of course not.
Yeah.
And I don't want to be out either. I've had more than enough scares lately. So I think that one's at the hospital's called Warringal. That's not one we've been to before.
Heidelberg, yeah. So it's a little bit further than we normally travel.
Yeah. But they've got the cancer, the breast surgeon, she said that they've got every single facility there, with everything that we need as far as my care. Because I'm a little bit more special needs now. That'll be okay, and hopefully I'll only stay the 2 nights and get to go home late on Sunday.
Yep. So that's what's next. We don't have any more appointments until then.
We do have a decision to make about what happens with the surgery, if there's any cancer left. We
can't make any decisions until then because
we kind of need to, because it depends on whether or not my port is removed.
Oh, true.
Yeah. So my port may be removed during surgery, but I still need the port if I have more immunotherapy.
Which we're not keen on.
No, and I only have to have more immunotherapy if there are still cancer cells present. But because of everything that immunotherapy has done, I'm really a bit scared to go ahead with it. So the breast surgeon and my oncologist are going to have a chat about that. My oncologist knows I'm not keen to do any more immunotherapy.
There are, so if we decide to have the port removed, and they do find some extra cancer cells, we still have some courses of action. They can still give you chemo in tablet form, and you could still have immunotherapy.
They just have to do it through my veins,
or something. Which isn't ideal, but at least it could be done.
Yeah.
I think the feeling I get from the surgeon and the oncologist is that the immunotherapy and everything has hit you very hard. I get the feeling that they don't expect any cancer cells.
I think they're afraid. And I'm more afraid
Afraid? What are they afraid of?
that something else is going to go
Oh,
wrong.
no, I get the feeling that the cancer cells should be pretty well dead, and by taking a little bit extra margin, you should not need any more immunotherapy. That's what I'm feeling anyway.
Yeah,
so.
let's hope so.
Yeah.
So I'm thinking that I may not want to do immunotherapy, in which case support will be removed when I have surgery.
So I think we kind of have decided that
we do have to have that decision made.
And I think that's what we're leaning towards, isn't it? Strongly.
Yeah, very strongly. Yeah. So anything else?
I don't have anything else to report.
No.
What's that? Do you have something to say?
No. Do you want another treat? You want a treat?
What did Mummy say? Treat?
All right. Cancer's tough.
But we're tougher.
See you next time.
Bye.